essentially taking out the healthcare workforce. Also healthcare facilities that would include long-term care facilities where we saw an emerging outbreak. So in other words, a nursing home or a state-supported living center where there were proven cases.
Like in all other states, this pandemic of COVID-19 will continue to take lives in the weeks to come. So that was from Dr. Reichel. One interesting thing I saw this morning on the City of Mobile website, this said, USA Health has partnered with the City of Mobile to establish a drive-through testing site at Lad People Stadium to provide testing to the general public. Potential patients will be screened over the phone to determine if testing is needed. Patients will, excuse me. Sorry about that. It was unmuted and it was still ringing. Again, potential patients will be screened over the phone to determine if testing is needed. If needed, patients will be given an appointment. Call 1-888-872-2650 between 8 a.m. and 2 p.m. on weekdays for a screening. No one will be admitted to the site for testing without an appointment and proper identification. Again, that was on the City of Mobile Facebook page. You can find more information there. As of this morning, the number of tested for Mobile County is 1,007. The statewide number total is 14,765, and the statewide number of hospitalizations is 240. Again, as you know, Friday, Governor Ivey posted a stay-at-home order for the entire state of Alabama. She did provide some frequently asked questions for individuals and businesses. We've shared those on our Facebook page. Also, of course, they're on the governor's website, so you can access those if you need to get more information on that. For this morning, our demographics that Dr. Randy Murphy, our epidemiologist, gathers from the ADPH website. This was as of 7 p.m. last night. At that time, we had 128 cases in Mobile County. The majority for age were between the ages of 19 and 64. That was 75%. The majority for gender was female, 57%. The majority for race was 55.5%. For ages, this one we don't have quite as much information. What we do is 10% between 1964, 15 over the age of 65, and then most of them we don't have a lot of that information. I'm sorry, that was for hospitalized. And then for zip codes, this is if you have 20,000 or more residents in that zip code, we can give that information. There was 8 in 36605, 19 in 36608, 8 in 36609, and 20 in 36695. Again, all that data, if you want more of it, is available on our Facebook page, I Love MCHD. We know some people have said they're having trouble seeing that, the details. You can go to our mchd.org website, and under News, you can click down and see a full PDF version of that, which is perfectly clear if you're having trouble reading it on our Facebook. Again, Dr. Murphy sent this just before we went on the air. This was changes in quarantine order from the ADPH. It reads, effective immediately, any person who has tested positive for COVID-19 other than institutionalized persons shall be quarantined to their place of residence for a period of 14 days after receiving positive test results. Any person quarantined pursuant to this provision shall not leave their place of residence for any reason other than to seek necessary medical treatment. Any person requiring assistance while under quarantine may contact the Alabama Voluntary Organizations Active and Disaster, VOAD. That website is alvoad.org. communityos.org/CMS/. While under quarantine, the person must take such precautions as directed by his or her healthcare provider or the Department of Public Health to prevent the spread of the disease to others. So that was something brand new from ADPH today. Now, because we didn't have this update on Saturday or Sunday, we've got a lot of questions from the public and the media. Too many to get through today. I'm going to take the first ones we got, and then I'll continue giving those tomorrow. Could you give a daily update on the number of people with COVID-19 who were admitted to each of our hospitals? If people were actually made aware of the day-to-day uptake and admissions, it would be a wake-up call. Well, our staff said, while we are doing everything we can to impress upon the public the seriousness of COVID-19, we remain under HIPAA constraints and must be careful to release only the amount of information necessary. Releasing the specific number of patients being treated for this virus at each individual hospital presents a possibility of information being used to identify specific individuals. This is the hospital's information. It's not our information to give. Really, it would be up to each individual hospital if they choose to give that, but through the health department, we're not. Again, I feel another subject. How many of the hospitalized patients have been discharged at this point? If you'll look on the characteristics that Dr. Murphy has compiled, the one the other day had 22. And her response, I've been told that we do not have that information. Our infectious disease and outbreak investigators have been focused on the initial interviews of newly diagnosed patients. That's our main priority now. As you can see, the numbers keep going up each day, so we have a limited number of staff. Every patient who does test positive, we do go out and talk to them, talk to their family, and do a background check to see where they've been and other potential places where the infection might be spread. What is considered a fever for employees to stay home? We go by the CDC requirement of a fever, which is a temperature of 100.4 degrees Fahrenheit. You can find that at the, more information on that at the cdc.gov website under quarantine. Again, here's another question from one of our Facebook followers. Is there a way to do an antibody test to see if you've had coronavirus? Yes, a positive antibody test would be an indication of previous infection. Another one from our Facebook friends. Is it possible to get an antibody test if we think we've had the virus previously? MCHD does not have COVID-19 antibody tests. The city of Mobile has some, but we don't know officially who can offer the test to the public. That might be something to reach out to the city of Mobile, especially now that they're starting to offer them more of the sites with USA Health. Is there any plan to do widespread tests of nursing homes and assisted care centers in the county, or has this been done? There are no current plans. Each facility is handling their own residents in consultation with public health as needed. And many of these, throughout the year, not just during this, we have our healthcare coalition, which involves the health department, all the hospitals here in Mobile County, and nursing homes and facilities. So they've been in contact with each other on a monthly basis well before this pandemic occurred. So we have a good relationship and kind of know what's going on with all those. So let's see if I can get a few more in before we run out of time. One of our TV stations were asking about the mask. With the CDC guideline for people to wear masks, what masks work, what masks don't, how to wear, how to clean, who should wear, adult versus children, healthy versus underlying conditions. The CDC continues the spread and effects of the CDC continues to study the spread and effects of the novel coronavirus across the United States. We know from recent studies that a significant portion of individuals with coronavirus lack symptoms, which are asymptomatic, and even those who eventually develop symptoms, pre-symptomatic, can transmit the virus to others before showing symptoms. This means that the virus can spread between people interacting in close proximity, for example, speaking, coughing, or sneezing, even if those people are not exhibiting symptoms. In light of this new evidence, the CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as grocery stores and pharmacies, especially in areas of significant community-based transmission. Again, we want to reiterate, the COVID-19 is mostly spread through the droplets produced by a cough or a sneeze. It's not really an airborne, as we know, like, say, measles. So the best thing to do, if you do cough, try to cough into a tissue, get rid of that tissue, cough into a sleeve. If you, make sure, keep your hands clean. The best is, hot water and soap. If you're out on the road, hand sanitizer is great, but, regular washing hands with soap. Disinfecting high-use areas, doorknobs, anything that you touch a lot, try to do that. And try not to touch your face, because that's the easiest way. If someone's coughed and they've touched a surface, you touch that surface, you touch your mouth, your eyes, there's a good chance you can get infected too. So I'll try to get one more question in here. This is for today. Are we seeing clusters or hotspots emerge within the county? We report the number of cases by zip code for Mobile County with zip codes with greater than 20,000 population. In general, and as expected, we are seeing the highest number of cases reported in zip codes with the highest population. We see a small number of cases reported in the most rural areas of the county. Well, like I said, we've got a lot more questions to answer. We're just going to have to carry this on to tomorrow because we know there's other people having news conferences you want to view. So until tomorrow at 2:30, again, this is Mark Bryant, the Mobile County Health Department. If you do have any specific questions about COVID-19, please call our hotline at 251-410-MCHD, that's 6243. They can answer many of your basic questions that you might have. If you have other specific questions, you can go to our website and our Facebook page. We have numbers for the ADPH. They have a 24-hour hotline. You can ask very similar questions. But until then, if you have any more questions, please email them me to mbryant, BRYANT, at mchd.org. If you send them through Facebook, we have so many posts, there's a good chance I will miss it. So if you want a direct question, like the people we had today, that was a direct email. So please send those to us and we'll try to get them answered for you tomorrow. Thank you and be safe out there.
All right, y'all, we were just listening to J. Mark Bryant with the Mobile County Health Department. So sorry about that echo. It seems like they're having some technical difficulties this afternoon. So we're going to make sure we get you all of that information right here on Fox 10. But we did get some new information. He said that about 1,007 people have been tested in Mobile. Across the state, that number is 15,755. Now, we want to talk about confirmed cases in our area. In the state right now, confirmed cases, we have 1,952. Mobile 143, Baldwin County 38, Clark County 9, Washington 5, and Escambia County, Alabama 3 confirmed cases of COVID-19. So you'll definitely want to stay tuned right here on the Fox 10 News. We're going to bring you more information coming up at 3 p.m. with Mobile Mayor Sandy Stimpson. But until then, we'll see you soon.